Hi, I'm Ted Owens, host of Mountain Health Today, a program where we talk about pertinent information that has to do with your health and well-being. Our guest today is Mr. Harry Weiss, President and CEO of the Tahoe Forest Health System. Harry, good to have you with us today via Zoom.
Thanks, Ted. Happy to be with you.
It's been a little while, so I look forward to our discussion today. Today we're going to be talking about opioid care and medication-assisted treatment program, or MAT, that is now offered at the Tahoe Forest Health System. Harry, can you tell us a little bit about what that award is? Why don't we start there?
Sure. We're happy to share that Tahoe Forest Hospital was among 53 hospitals recognized for their progress, our team's progress in treating this opioid epidemic. And by backdrop, our health system team really cares about every resident of our community, and any of those especially that might have an addiction to opioids, other drugs, or alcohol. And this specific recognition is about opioid treatment progress. Cal Hospital Compare is a not-for-profit organization that provides Californians with really objective hospital performance ratings. And they released their first opioid care honor roll this year, which recognized hospitals for their progress and performance in really promoting safe and effective opioid use, minimizing it, and treatment for patients with an opioid disorder.
Harry, let me ask you a question.
Sure.
So I think it was 89 health systems or hospitals put their program forward for consideration. But it's true that not all hospitals have, or health systems have, an opioid program at all. Is that a fair statement?
That's correct. There's more than 360 hospitals in the state. About 89 chose to respond, and 53 were recognized for strong performance.
And another question, what can turn into opioid abuse can be very innocent, and it can happen anywhere and to anyone, correct? Tell us a little bit about that danger.
Absolutely. There are a variety of pain relief medications. One that has made the news in various cases, in various locations rather, was OxyContin, Percocet, hydrocodone, Vicodin, and these can be prescribed for very legitimate needs, but depending on the duration, the intensity, addiction can occur.
And let's go to Cal Hospital Compare. Now they compare on many different platforms and different issues, but with respect to opioid treatment or abuse treatment, what kind of rigor are they looking for in a program?
They're really looking for how are we addressing the opioid use on new, fresh cases that might normally suggest that a patient receives an opioid type medication. You know, are we finding alternatives to opioids that can provide equal pain relief? So that's an important part. And then also, do we have any programs that could help a patient recover from an unplanned addiction to prescription drugs?
Now, to be fair, the use of opioids can be done carefully and properly. Does this program have any impact on the proper use of, or the careful use of, and oversight with respect to the use of opioids?
The program does not interfere with a physician's independent judgment in the care of their patients, but there is continuing learning going on across the healthcare industry as to, are there effective alternatives, different types of equipment and so forth that can provide an alternative to an opioid that might have been administered during that same recovery episode for the patient.
Harry, before we cut to a break in a minute here, for the folks at home, how can they get more information on Tahoe Forest Health System's medication-assisted therapy program?
A great question. If you go to our tfhd.com website and just look on the home page there, we've got a great spot right in the middle that says Ask Questions, and you can type in Medication Assisted Therapy Program, and you're going to get a lot of specific advice. And then you can also, if you'd like, call 530-582-1212 and ask the clinic about your interest in medication-assisted therapy.
Thank you, Harry. We're going to take a break here. I'm Ted Owens. You're watching Mountain Health Today. We'll be back in just a moment. I'm Ted Owens, and you're watching Mountain Health Today, brought to you by the Tahoe Forest Health System. We're talking today with President and CEO of the Tahoe Forest Health System, Mr. Harry Weiss. And our subject matter is medication-assisted treatment programs that the Tahoe Forest Health System offers, particularly around the use of opioids. Harry, my question here for this next segment is, who is this program, this medication-assisted treatment program, specifically designed for?
This program has really been designed for individuals who have gotten that unintended addiction with prescription drugs, typically opioids, and there's a variety of those that are out there. One of the most common heard in the news is OxyContin. It could be Percocet, hydrocodone, Vicodin, etc. But it's also for alcohol addiction as well. And I think the important context of all of this, our health system team believes that all diseases deserve, need that fair and timely treatment, and treatment with great respect. So there shouldn't be a stigma about any type of disease. We're here to help our community with physical health needs, with injuries, and also with addictive and mental health illnesses. They all deserve respect and timely attention.
So the program, it endeavors to provide a safe utilization of opioids and a controlled level of medication, correct? Does it work? Does the program provide guidelines for providers, or do providers operate within a level of professionalism that suits the program?
Every physician or physician assistant or nurse practitioner that actively participates in a medication-assisted treatment program has been certified before that they can be active with this particular program. That means that they're certified about recognizing the disease that they're dealing with, and that they're certified to handle the specific alternative medications that can help a patient feel normal, not experience highs or withdrawals, and that cravings are reduced. So these are all things that come with a certified physician assistant, or nurse practitioner. And we're really pleased that we have several certified providers to help our patients who struggle in this opioid medication addiction arena. And they can also help with an alcohol addiction as well.
Harry, you said something just a moment ago that was interesting with respect to cravings. It's my understanding that not everyone is impacted by opioids the same way necessarily. And this is why it shouldn't be an embarrassment or a shameful thing. Everybody can be different, correct? And this program works closely with patients to subside cravings and to monitor how they're reacting to the pain medication, correct?
Correct. This program is multifaceted. It can help a patient who realizes that, they have responded to it and they have a concern about the dependency, the cravings, et cetera. Or it could be a family or a physician referral. But again, there should be no stigma about any health challenge that a patient feels. Some patients do react to these medications differently than others, and our trained certified physicians are trained to be able to help with that. And the medication-assisted therapy or treatment program really contains three important programs or aspects. First of all, it's that medication alternative, and then it talks about or involves counseling, and last, it involves support.
And the program is equally important also in recognition of developing trends and what have you, or working with patients so they can recognize whether or not they're slipping into an abusive utilization of the medication as well, correct? It's proactive.
That is correct. So it helps all of our medical staff members as they receive continuing internal education on new treatment protocols that might use certain medications for a shorter period of time, or might even propose other medications that can provide equal pain relief but don't have the risk of addiction. One of the things that's really exciting to me as we started the medication-assisted treatment program is I had an opportunity to review a product in one of our service lines recently. And so there's new technology coming out that our provider team is very open to, our physicians are very open to, that there may be tools that allow a patient to experience pain relief, healing, acceleration, et cetera, with greatly reduced medication. And so those kinds of new technology advances, I want to assure our community that we're open to that so that we're creating an optimal recovery path for whatever was the pain cause, looking at new technologies that might not always involve a needed drug.
Well, thank you, Harry. We're going to take a break right now. For the folks at home, we're talking about medication-assisted treatment program at the Tahoe Forest Health System, wrapped around the use of opioids. I'm Ted Owens. This is Mountain Health Today. We'll be back in just a moment. You're watching Mountain Health Today. I'm Ted Owens, your host, and I'm here with Harry Weiss, President and CEO of the Tahoe Forest Health System, and we're talking about a very important program called the Medication Assisted Treatment Program, or MAT, a program designed around the use or potential misuse of opioids and other medications. This is a program that is offered at the Tahoe Forest Health System. Harry, before we went to break, we were getting ready to talk about things like medication and counseling and the support mechanisms as a part of the MAP program. Let's start with medication. What types of medications are deployed should someone find they have an issue with the use of opioids?
Our licensed physicians and physician assistants have multiple medications available to them, and I won't bore the public generally with what those are, but they are alternatives to the opioid that the patient might have become addicted to. And it's not just about swapping a medication or a drug, but it's really about helping patients in a holistic way, in a solid way, reduce their dependency and remove their dependency on the particular opioid that was a problem. And again, by backdrop, the most important message throughout this whole program is this topic may touch almost every family in America and might touch many families within our own region. And so we want you to know that we care deeply about every family, every patient in our region, and all diseases deserve confidential and professional, timely treatment. So we just urge you to listen to the information that we have to share. This is a message of great hope and courage.
Harry, some of the medications that are deployed when someone has developed, say, an addiction to opioids, do those medications cause a feeling of being high or anxiety, or do people still have cravings for the medication that they've developed a problem with, or do you feel normal?
The beauty of the alternative medications, which are designed to reduce the addiction, is they remove the craving for the opioid relative to addiction. A patient feels much more normal or on an even keel. They don't have those tremendous highs or lows, don't feel those tremendous withdrawals. So that's the beauty of a medication-assisted program. That's part A, which is medication, and then part B is critical counseling, and then there's a part C as well.
So the counseling part, I think, is perhaps the most important, so that somebody is walking beside the patient as they move through this journey. It's not something that they can do alone, right? The counseling is actually exceptionally important, correct?
Absolutely. These three legs or three pillars to addiction recovery are critical. So with counseling, we have a variety of trained mental health professionals that can help a patient understand why this addiction occurred, what problems it's causing for them specifically, and for all of those people around them that they hold dear to their work, etc., and even to their health. And so we have counselors that will engage with every patient in this in a custom recovery program. It will teach patients how to cope, make good choices, and how to minimize relapse. Again, this journey is about being courageous, as recovery is a day-by-day journey. And then the last leg is support.
Excuse me. The third leg of the stool is support. So what role is there, if any, with, say, family or friends?
Really, the support of family and friends is vital. It's equal in importance to counseling and medication. And we would urge family members, if you're hearing this program today, your role is just as important as our medication and counseling. So join that person that's struggling, encourage them in the support of their recovery. And as they're working on the medication, the counseling, be there with them every day to encourage them and share with them and acknowledge and affirm the progress they're making. And you will find that it's rewarding for you. It'll certainly be very rewarding and helpful for a solid recovery for the patient.
Thank you very much, Harry. It's a very important topic today. Congratulations on receipt of the MAT Award. And let me see if I get the number correctly. If anyone is interested or would like to find out more about the MAT program at the Tahoe Forest Health System, they can do so by calling 530-582-1212. Did I get that right?
That's correct. And you can also go to tfhd.com where it says ask questions and type in medication assisted treatment program. And there will be a whole variety of resources there for you to help you to achieve success.
Well, thank you very much. I'm Ted Owens. This has been Mountain Health Today. We've been with Harry Weiss talking about the MAT program at the Tahoe Forest Health System. Thank you for watching.